Brought to you by New Jersey Sharing Network.
Welcome to New Jersey Capital Report. I'm Steve Adubato.
And I'm Rafael Piraman. How are New Jersey's kids doing? Joining us now to answer that question is Cecilia Zalkind, the Executive Director of Advocates for Children of New Jersey, whose latest survey measuring the health and well-being of kids throughout the state was recently released. Cecilia, welcome back to the show.
Great, thank you for having me.
You like our new studio here?
I love your new studio. It's fabulous.
NJ studio in Newark, huh?
Fabulous, beautiful.
So the report is called New Jersey Kids Count. This is the report 2016. It's the 25th report that you've done. You've been doing it for 25 years.
This is our 25th anniversary. We're one of the first states that the Annie Casey Foundation chose to do their National Kids Count project.
And we've had you for a number of years after the report comes out. Sometimes those reports have been very bleak. This one's not so bad. What's the good news in this report?
Well, I think the best news is in the area of health and education. In the health arena, far fewer children lack health insurance. Actually, under 100,000 children do not have health insurance, compared to about 10 years ago when we were talking about 500,000 children without health insurance. So we've made great progress in that area. And other health indicators, immunizations are up, prenatal care is up, and education is actually doing well as well. Well, you know, the Casey Foundation actually 2 weeks after our report did their national rankings of the states. We're number 7, and we're actually second in the country in education. More access to preschool, higher graduation rates. We're doing very well in that area.
Go back to the preschool. We've had many conversations about the importance of pre-K education. We are doing this program as the state budget is being struck at the end of June 2016. It'll air after that. What's at stake right now in the State House in terms of decisions being made as it relates to universal pre-K?
Well, it's a big year. We've been part of a PreK Our Way campaign to...
Explain that. That's Sam Crane and some other folks.
Yes, Brian Marr, who's a businessman who is strongly invested in the idea of high-quality early education. The goal of the campaign, in which we've partnered, is to fund the School Funding Reform Act, which would have extended preschool to about 90 more districts and about 35,000 more children. It was passed in 2008. It's never been funded. So we've had this campaign all year, and very exciting, Senator Ruiz.
Senator Teresa Ruiz, who is the chair of the Senate Education Committee.
That's correct. She put in a budget resolution to put in an additional $25 million for preschool for expansion.
Where is that now as we speak?
Well, I think it's probably on the governor's desk.
What do you think? Again, we're going to find out soon enough. That is a critical bill that expands pre-K into what areas?
Well, they are the next tier of low-income communities beyond the former Abbott district. So these are communities with 40% or more children who are considered low income or eligible for free and reduced lunch. A lot in South Jersey, some in North Jersey, districts like Clifton, for example, Belleville, but many in South Jersey.
And the basic point here is that people will know soon enough whether Governor Christie has decided to sign that legislation or not.
Yes, they will. And now the price tag is much higher than $25 million, but this is a critical first step. We're hopeful the governor agreed to allow the state to apply for a federal grant that would expand preschool, which is going on now in about 17 other districts, not at the level that this preschool would be funded. It's just for
but preschool matters.
Preschool
children's
absolutely matters. It matters to every aspect of child well-being, to children's health, to education. So many studies document that preschool is the best way to start on a path to school success.
So Cecilia, let's go back for a sec before we get into the disturbing discoveries that you made during this survey. The good news, health and health coverage, right? Do you attribute that to the Affordable Care Act, the so-called Obamacare, essentially?
Well, I think it's a combination of three things. One is we've had a very strong child health insurance program for many years, family care, and the governor has maintained that investment. We probably have the best program in the country. And then the governor took what's called the Medicaid expansion money, which allowed low-income families to be covered, which brought more children in. And then I think children at slightly higher income levels are now benefiting from the Affordable Care Act.
Okay, so let's talk about the disturbing aspects of the report, the things that you found that not so positive?
Well, as in other years, the issue is the economy and its impact on low-income families. We still have a high percentage of children living in poverty in New Jersey.
What's the percentage? Yeah.
I'm sorry, Rev.
Yeah,
Well,
where
you know,
and how much?
Across the state, it's about 16% of kids, and actually it's improved slightly over last year. But those numbers are misleading because you have to look at the pockets of poverty. So urban areas, in Newark, for example, 1/3 of children are living at or below the poverty level.
Right where we are taping,
Yes.
at the NJTV studio in Newark, downtown. You were saying 1/3 of the children in this city are living below
Yes.
the poverty level. Define what that really means.
So the poverty level is quite challenging for families. It's about $23,000 a year for a family of 4. So imagine living on an income, paying rent, putting food on the table, ensuring that your child gets to school every day on income that low. That's a huge challenge. And with rental costs in our state, it's an even bigger challenge. What we actually look at beyond the poverty level is low income. So that's considered double the poverty level, so around $46,000 a year for a family of 4. 1/3 of children in the entire state are considered low income. And I think for a state that's as expensive as ours, that's a much better measure of need.
Now, you also rank the counties,
Yes.
right? Those are doing best with regards to kids and those worse. What counties are doing best and which ones are doing worse?
Well, at the top of the list, and they tend to shift places from year to year, are Morris, Hunterdon, Somerset.
They're doing better.
They're doing better.
There's more money there.
Well, yes, there's more money there.
That's it. Basically, there's more money
Right.
there.
Yeah.
And we rank along a number of indicators, but the bottom line is income and poverty. Bottom counties are the southern counties. Cumberland is 21st, Atlantic is 20th.
21st out of 21.
21st out of 21.
Why is Cumberland, why are the children in Cumberland County struggling so much, suffering so much? Seal?
Well, you know, I think we're up here in an urban area.
Right.
We're much more aware of the challenges. There are different challenges in South Jersey.
Like?
It's a rural community. You have a lot of migrant workers that come in. You have less access to services, much harder. You know, you spread out transportation.
Harder to get health care? Harder to find a hospital?
Yes.
Harder to find-
Harder to find anything.
Anything.
Yes. And I think, you know, those counties struggle. They don't have the, you know, you look at a county like Essex, for example, there's a balance, right? You have cities that are really struggling, like Newark, East Orange, Irvington, but you have other communities in Essex that balance that. I think in some of the southern counties, you don't have that balance.
More poorer areas.
Yes, more poor areas.
Let me ask you, one of the things that Raf and I have been dealing with, one of the topics we've been dealing with a lot is this whole question of the minimum wage. What do you believe this fight for 15 in New Jersey would mean as it relates to helping the children that you are so concerned about? Would it have any discernible impact?
Well, I think there are two things. One, yes, it would have an impact. It would raise family income. Again, when you're talking about the high levels of poverty and low-income families, you're really talking about working families. So I think any increase in the minimum wage would help them. But there are other issues. We're very concerned, for example, that what would be the impact on, let me just use an example, the child care industry. So you have child care providers who've been struggling for 8 years, right, to be able to pay their workers. If they're required to increase the minimum wage without additional state support, who's going to pay? The parent is going to pay for that.
Tough question. Cecilia Zalkind, 25 years the team has been doing this, putting out this Kids Count report. By the way, where can people get more information on it?
On our website, www.acnj.org.
Advocates for Children of New Jersey, and thank God you are advocating. Thank you, Seal.
Thank you.
Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision. Because you can make a difference and save a life.
Also brought to you by Summit Medical Group, Seton Hall University, and by the New Jersey State Nurses Association and the Institute for Nurses.